What about and I think this is for both you and Mick jump in too. When the plan goal and the provider goal when they don't align, and I'm thinking of the providers have so many quality metrics they're focused on, right, between MIPS and maybe ACOs and everything else, right? Um, and um, but how do you handle that? How do you kind of come to the table, or what does that look like?
Go
Do you want
ahead.
to go for it? Yeah, so I mean, we've been evolving our provider engagement strategy as well. Some relationships are more, mature than others, but we're when we started incentive programs for our provider partners, it was kind of what we thought was standard across other payers. Really looking to see how we can align our incentive with other carriers, and competitors, mostly because of the issue that you're bringing up. We want to make sure that we're making it as easy and aligned with other priorities that providers might already have. And in kind of doing so, we've built these very close relationships with a handful or so of our providers, and we really work with them to understand, depending on how frequently we meet with them, where are their priorities for their patient population. Are there a lot of patients with diabetes that they really want to focus on, or hypertension, or what is their goal in their clinic or group of clinics? What are their workflows? We really want to have this close knit relationship with our partners to say, we have a quality improvement team. We can provide some best practices and research. We can walk you through workflows and how you can target some of these measures, to kind of partner in that sense. Some clinics are more open to that type of relationship than others, of course, but that's kind of where we've evolved our relationship. We also have some clinical advisory panels with some key medical groups and hospitals, and then we'll also bring our incentive program to them to ask for feedback on an annual basis to say, what is it that you're seeing? Does this align with what you're seeing with other carriers? What other priorities and stars and in your patient population should we consider for the future iteration of our incentive program? And we've gotten some pretty solid feedback, but again, it's, ever evolving, just like how the STARS program is always changing too.